Good morning. I'm Bryant Moorhead, County Manager. North Carolina general statutes require that on the first regular meeting in December of each odd number year, the Board of Commissioners shall choose one of its members as chairman for the ensuing year, which is why the meeting is being conducted in this order today. I call the meeting to order. At this time, I'd like to stand. We'll have the Pledge of Allegiance and then ask Reverend Patrick Womack to lead us in prayer. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
May we pray. Almighty God, our Father, you who are infinite, eternal, and unchangeable in your being, wisdom, power, holiness, justice, goodness, and truth, we appeal to you, O Lord, to grant grace and mercy, that in this meeting your very will might be accomplished. We continue to thank you for those who serve us as commissioners and as others in the county who labor on our behalf, those even on days like this who are out early, making sure roads are clear, that ways are safe. Lord, we pray for your blessing. We pray that you might grant us grace, that we would not simply see the way that things are and ask why, but we might have the grace to see how things could be and ask why not. May your will be done. In your name we pray. Amen.
Next on our agenda for public hearings, there are none. So at this time, I will entertain nominations for chairman of the Haywood County Board of Commissioners.
I'd like to nominate Kevin Ansley for chair.
Second.
Motion made by Commissioner Rogers, seconded by Commissioner Long. Any other nominations? Hearing none, I'll close. Call the vote. All those in favor of Chairman Inslee being chair, say aye. Aye. Opposed? Congratulations, Mr. Chairman.
Thank you, Brian. Thank you, other commissioners. I appreciate the opportunity again to serve as chairman. At this time, we'll take nominations for election of the vice chair.
I'd like to nominate Commissioner Rogers.
Second.
Any other nominations for vice chair? All those in favor of Chairman Rogers as the vice chair, say aye. Aye. Anyone opposed? Okay, that's unanimous. Thank you.
Thank you.
Okay, our next order of business is our public comment session. We allow 3 minutes for public comment, and we'd appreciate if you'd state your name and where you're from, maybe. Would anyone like to address? I don't have anyone signed up to address the board, but would anyone like to address the board at this time? Seeing no one, I'll close the public comment session. We'll move on to constituent concerns. And Mark, do you have any this week? Okay. Kirk, do you have any?
No, sir.
Brandon?
No.
Tommy? Yeah. Okay. Okay, thank you. And I hope everyone had a great Thanksgiving. Okay, our next order of business is our administrative agency reports. And the first item is the introduction of new and county employees. And we have our county manager, Bryant. Go ahead.
Thank you, Mr. Chairman. Today we have 4 new employees to announce, 2 at Health and Human Services. If you'll stand and remain standing. Emily Norman, Renee McCoy. For the Sheriff's Office, they may not be here, William Brigden and Tyler Shade. Thank you. These are new employees.
Okay, thank you all for coming this morning. We'd like for you all to come and so we can see you can see who we are. So thank you all for considering working for Haywood County, and we appreciate that. And if you'd like to go on to work, you can, but if you want to stay for this, that's fine too. So, okay. Our next item of business is the update from Haywood Regional Medical Center on employee wellness program, and we have our county manager, Bryant Moorhead.
I'm going to turn it over to Rod from the hospital. I'm excited about the partnership, about the wellness program. We've talked about it at some length. So Rod has some announcements about this week and going forward.
Yeah, so good to see you guys. Thank you, Commissioners, for allowing me to speak again. We're excited about our new program, the Haywood County Wellness Program. We have, oh, good, you're standing right beside me. Thank you. Of course, just a recap, we'll be doing some annual lab results, and so that we can track and keep up and give information about not the individuals, but data about some of the issues, whether that's heart, diabetes, hypertension. Also, we'll be doing disease management, education. But the biggest piece of this is having a navigator to manage. And right here beside me, a 15-year nurse, Jamie Cavacos, will be our RN, who will be only responsible for county employees. They'll be able to reach out to her not only for education, but that she will be tracking, making sure if there's identified issues that she's connecting them with any hospital or any services to make sure that we're having followed through, so we can hope reduce them and be more prevention driven as the county to support your employees. I think we will also, our fitness center, effective today, your team can start signing up for it and get a hefty discount. And then also there will be some free training with our specialists and our trainers to kind of help them get used to working out and doing the right thing. And then, of course, Jamie will get that data. I think the biggest thing we want to try to do is try to pull that data, show you the success rate, that hopefully we're getting healthier, and you can see that in the tracking. And then also look at, which I think is important, is the prevention side, because whether you have diabetes or hypertension or your weight loss or weight is up, that we can show and track actual reduction. So we're really excited about that, ready to hit the ground running, and we look forward to support the county moving forward. Any questions from your guys?
Anyone have any questions?
I do. Is this going to be just voluntary for the county employees, or are they required to attend a certain amount? Okay.
They did a wellness survey back several weeks ago, and 90% of the respondents, close to 300 of our employees, took it, and 90% said that they would take, I guess, a biometric screening if it was offered for free. And so that was very positive, so we think most of our employees will take advantage of it. We're excited really about the gym memberships that Rod said. It starts today. Employees can start signing up and beat the rush before New Year's starts to go ahead and get in the habit of going to the gym between now and New Year's.
The gym piece is important, but being a nurse myself, one of the big drivers, and I've seen this with companies, when you can go in and get your annual screening, whether that's A1C, or a CBC, and we're pretty much taking that down to cost and all that. And the goal, most people who have hyperlipidemia or early stage hypertension or their A1C's climbing, those are the ones, if they can identify those earlier, you don't have that cost associated long term, but then they're healthier. And I think a lot of people are afraid to walk into the doctor, especially when they hit around 40 years old. And I hate to say it, but that's the magic time that I see changes. This kind of will help them see, where you fall, because some of that secret, if you've got hypertension or if your cholesterol is high, that's what's going to come on and get you. And it might not get you day one, but 10 years later is when the damage is done. So awareness. So to me, honestly, one of the biggest programs is having a navigator to say, hey, your cholesterol's high, and this is what you need to do, and we're going to get you set up. And whether they go to Mission, Haywood, it's irrelevant. We're not trying to steer the piece. We want to take, patients or your staff to where they feel comfortable. But the goal is to have someone to say, you had this done, and it's been 30 days and I'm following up. Have you been to the doctor yet? Someone to kind of steer it, and then when they don't understand how that can cause, damage to their heart or they're, give you an opportunity to stroke, you have this educator that's going to help and guide them and lean them in the right direction to try to say, this is really important to your long-term health. So I think, and it reduces costs. We do that in our own company. So anyways, we're excited about that support. And the fitness piece, I work out for 3 months and then I take 3 months off. I know you see me in there and so I mean, everybody is what it is, but to have that option will be great too.
Do you have any other questions?
I know it's not a requirement and there's not a penalty, but is there any kind of benefit for the participants?
An incentive.
Yeah,
Some type
an
of
incentive to
incentive.
do
Seems
it.
like we talked about that before,
So,
maybe.
so the hospital has reduced the fee and cut that in half. If employees sign up and get their own membership, and we're going to work with the fitness center to get the data, the county will pay for the other half. If they go on average 2 times per week per quarter, we know vacations and things pop up and you may not be able to make 2 times every week, but over that quarter, we will reimburse the employees for their membership. So that's the incentive, is if they go and we'll pay for it. We didn't want to give it to employees that weren't going. That's not a good use of the dollars, but we think that this is a good way to approach it. We're excited about that. So when we do reimburse, though, that's a taxable benefit. So if it's $18, we will have to withhold taxes on that. So there will be a slight cost to employees, but it's fairly marginal.
So do they pay the full amount up front and then get reimbursed, or they pay half up front?
That's correct, yes. They'll pay, well, not the full amount,
They'll
the
get
discounted rate up
with the
front.
price.
Okay.
And then we'll collect the data, because when you come in and swipe in with your badge, we'll be able to track it. And then our team will meet with the county manager every month and go over data. We won't use individuals' name. Same way with the lab work that's done. We'll protect under the HIPAA law everyone's name, but we'll be able to come back and tell you out of your 500 employees how many have X, Y, and Z. So it kind of gives you an idea where we want to steer our education. And we will go on site with our education team. We have dietitians that are going to support. This is our attempt from the hospital to do, making community healthier, to drive our first wellness program. We've done it throughout other LifePoint hospitals. And from the county standpoint, I mean, we've taken this thing down to almost cost, just to kind of steer where we want to go to try to help in the sense of making communities healthier.
Okay.
Other question?
Is there any way we can track progress as far as our overall health of our employees, maybe over a year?
Yes, sir. We'll be able to, when they, the question will be, and I don't know when you guys will decide when you want to start initiating some of the blood work, but we can do that whenever. But we can track not only from that, but we can also track from the fitness side and then the education side, who's signing up. We're going to do blogging for people who don't want to come on site, but we could probably pull where you have a deficit from an education standpoint, and then also some of the hard data in regards to if we'll weigh, we'll measure, you'll whether know your BMI index and all that. So yeah, we'll be able to give you, the goal is to track this. We made this setup where if tomorrow the county decided it wasn't successful, in 30 days you could walk away. We didn't extend, I think it's a 3-year contract, but we had an easy out. Our goal is to produce data that will show outcomes so that you can see that the program's being successful.
He said it's a 3-year program. This will be really our first year, get that baseline data and see how we improve. Are we getting healthier? Are we seeing employees with less days of work missed? Those kinds of things are what we hope to see in years 2 and 3 that we've changed. Health insurance increase this year was, I think, 37%. I don't know if it will ever decrease because medical costs go up, but if we could just slow that growth through wellness, we've saved or avoided spending some money that we have. So.
Well, and the big piece, honestly, with our cancer programs, we have nurse navigators who are driving and staying on top, sending cards. We're, saying, how are you doing? And of course, having Jamie here, she's high octane, but very, been a nurse for 15 years. She will help drive the success. And I think where you see these programs fail in the past is when you don't have somebody who's trying to help guide them, keep up with them. Because a lot of times there's, knowledge deficit based on, your body and what's going on with it. So we've seen success in our cancer program with the navigation driving it.
Early detection is a key with all that, so.
Oh, definitely.
I know we had talked about this before, Brian. One of my concerns is especially social workers, law enforcement, and EMS. They see so much, and this I know is primarily physical, but if we're going to be evaluating them and looking into their health, could we incorporate some questions? How are you eating? How are you sleeping? Do you need to talk to someone?
Yep.
Since the majority of the employees are going to use it, that might be an opportunity to get them with human relations to where they can actually do something to get them into counsel if they need it, rather than losing employees because of it.
Yes, that is the plan, is to not just offer just physical, but mental and emotional, everything that incorporates. Because it's not just being healthy does not just always incorporate physical, but also your mental capacity and your emotional capacity. I have worked in cardiac rehab for the past 4.5 years, and we have found that most of those patients that come after something that significantly happened, there is the emotional and mental capacity that they don't know how to handle. So the job is to determine who needs that help, and then also provide them with where can they go seek help. What can I do to get them in those areas where they can go talk with somebody, if there's a counselor that they feel comfortable with, if there's somebody that can offer someone to give them guidance on how to handle the things that they see every day.
So we'll have the questions for that.
Very good.
And we have an outpatient psych clinic now that we opened in October. So, we'll go wherever everybody wants. One's a physician and one's a nurse practitioner, and then we have social workers as well. So we have resources if needed. And I'm not sure if the county, if you have a certain amount that you allow your staff to go. I know at a hospital, if somebody has an issue, they can go up to 10 times or something, at least 3 on the hospital side. But from us, we will tie them into that as well, yes. We're trying to do the whole body, like you said, the mind and as also the physical side. I just need somebody smart here to remind me of that. So.
Any other questions? Okay, well, the main thing is what we're after is to reduce cost and make our employees healthy. And I've learned a lot just listening this morning and stuff. So this is going to be good, I think.
Yeah, and listen, I'm a data drive. Data is everything. We can, we want to measure outcomes. So that's our goal, is to be able to show you that and show you how many people are going and all the stuff. I'm interested too, because for health purposes and education, as we educate the county, and not only our goal is to expand this, we've done a little with the mill, but to expand this program and even create a concierge services where people can call, 24/7 around the clock if they have issues and tie a physician to it. So this is our first step to kind of build something that's even a bigger platform long term that will benefit not only the county employees, but other employees in the county as well.
Well, this has been a good decision, and having Duke Life Point's is a great asset in our community. I think Kirk serves on a lot of the hospital boards and was instrumental in getting you guys here. So we really appreciate all that y'all do.
Yes, sir. Thank you.
Okay, thank you. Okay. Our next item of business is our update from, we get a yearly update from Santac Environmental for the White Oak landfill, and we have a Santac Executive Vice President of Marketing, Ben Johnson, here this morning. Welcome.
Good morning.
Morning.
Thank you all for having us this morning. As many of you all know, Cheryl Dunson has done this for many years, and I am her new replacement. She actually retired and went on to other things, so I want to just thank the county and the staff and the commission for having us this morning, and want to give a few updates on the operations of the White Oak landfill this past year. So we'll get started. So the annual volume this past year from July 1, 2008 to June 30th, 2019, the total in-county volume was 69,002 tons. The total out-of-county volume was 74,680 tons. One thing I want to highlight, the White Oak landfill is only permitted to accept waste from 18 North Carolina counties. One thing that is brought up a lot that we hear, that I'm sure you all hear, is what about all these transfer trailers that are coming in with out-of-state tags? I'm going to tell you, these companies that haul waste around the Southeast will pull trailers from anywhere in the Southeast. There is no waste coming into the White Oak landfill that is out-of-state waste. So I wanted to kind of clarify that for you all. The total combined annual volume, excluding brush, is 142,978 tons. And again, that is only landfilled volume. The brush is obviously not landfilled. So the host fees return to the county. The host fees are paid on out-of-county waste between July 1, 2018 and June 30th, 2019. First quarter being July 1 through September 30th was $22,271. Quarter 2 being $17,584. Quarter 3, $19,951. And quarter 4, $24,374. One thing I wanted to highlight, you'll see a drop off between Q1 and Q2. This was due to a interlocal agreement where Buncombe County transferred some waste to a opposing landfill. You'll see that over Q2, 3, and 4, those host fees increase. We were able to secure some additional volume from some third-party contracts. So the total host fee from July 1st, 2018 to June 30th, 2019, $84,182. And the total host fee since the inception of the contract was $518,240. At this point, I'm going to turn it over to Ron Vale. He's going to go through some of our remaining capacity, current operating cell, and future operating cell.
All right. Good morning, guys. Thanks for having us here. I guess one of the topics of discussion that we'd like to update you guys on every year is the remaining life of the landfill. I know everybody wants it to last as long as possible, and Santec's contract, as many of you are aware, requires us to allow it to last a minimum of 30 years, and we're a little over 7 years into that, maybe close to 8 at this point. But anyway, wanted to go through this. The total, I'll look down at my paper versus up there. The total permitted airspace at the landfill phases 1 through 7 is 9.38 million cubic yards. That number typically doesn't change unless we change the slopes or add some area or something like that, which we haven't done. We have changed the slopes, but not added any area. So about 9.4 million cubic yards of airspace. The remaining projected permitted airspace, this is what's left in the cells that we have constructed now, as well as the cells we plan to construct moving forward, is 6.75 million cubic yards. And then each year we like to project the life out as of the latest aerial. We fly an aerial once per year, usually in May. That's when this one was flown, was May of 2019. So the information's a few months old, obviously. We'll fly another one next year. But we were asked by the staff to run this 2 different ways, and I'll explain that a little bit to you guys today. But Santec, our long-term utilization factor is about 1.3 cubic yards per ton. And what that is for every ton that comes across the scales, we anticipate using up about 1.3 cubic yards in the landfill, and that's waste and soil. So for every ton comes across, we estimate that we'll use 1.3 cubic yards per ton, and that obviously eats away at this 6.75 million cubic yards that I listed up there as we move forward. And at 1.3, we'll have about 32.3 years of life left. That 1.3 we've not achieved yet at Haywood County. We think that's probably important to point out. We think we will achieve it. The remaining counties that we operate landfills at, the 3 closest ones, we have achieved it or we're right at achieving it over a 15, 20-year track record. So we went ahead, and a lot of that has to do with settlement of the landfill, but we went ahead and projected that forward here just so you guys could see what we're pretty sure we'll get at this landfill. If you look at what we've done since we began operations of the landfill, we've achieved 1.49 cubic yards per ton, which brings us down to the second life that we have there. Those are actual AutoCAD ran numbers using tonnage that has come across the scales that we've measured. So these are all measurements that we've taken, and that's 28.2 years of life remaining using those numbers. So that doesn't take into account any additional settlement that we'll receive in the future, where the 1.3 does. And based on, again, our historical track record of the landfills, we're pretty confident we'll achieve that number. Just wanted to clarify that and go through that. So moving forward, we'll probably run both of those calcs for you guys so you guys can kind of see how we're tracking as we move forward. As far as construction goes, we updated you guys last year on Phase 4. We finished that sale in November of 2018. It was about 4.5 acres. The remaining airspace in that sale is a little over 500,000 cubic yards. And there's about a year and 4 months of remaining airspace in the sale. We anticipate it running out of airspace around February of 2021. So we'll begin next year in 2020. We'll push forward here. We'll begin removing about 400,000 cubic yards of soil in preparation for the next cell construction, and we're calling that cell Phase 5A. So we'll start moving that soil. That cell will be about 6.7 acres. It'll yield about 500,000 cubic yards of airspace, and it'll last about 2 years is what our projections are. So that's kind of just an update moving forward. The Phase 5A is not quite as efficient of a sale as Phase 4, and then next time around we'll probably be talking about 5B or maybe 2 years from now, and it's a little bit more efficient of a sale. But just to give you guys kind of an update on where we're moving in the near term in the future. If that's all I have today, if you guys have any questions, let us know. We'll be more than happy to answer them.
The other commissioners, me and Tommy had the privilege of meeting with them earlier before the meeting since we're on the Solid Waste Committee, but you might want to explain to them why, even though there's more acreage on that 5A, of why we're not getting as much compaction in that area, and explain what we're going to do after that.
Absolutely, and we talked a little bit about that in our meeting. But the 4.4 acres, we've been filling in it for a year now, and we still have 508,000 cubic yards remaining. So the initial airspace was quite a bit more than that. I don't have that number here, so I can't say what it was. And then the Phase 5A is 6.7 acres, and it's 500,000 cubic yards. So if you run a cubic yard per acre, obviously 4 was more efficient, is what we would call it, than 5A. And the reason being is you're stacking up one side of 4, and it's a tapered side, actually, and we didn't talk about this much, but it's just not a real efficient sale. Now, when we go to 5B, we'll be stacking up against 2 sides. We call it piggybacking. So not only do you build this, 5 to 6 acre sale, but you're filling up over maybe 10 to 12 acres, depending on how the geometry lays. It's all about the geometry. The higher you can stack it, the more efficient the cell will be, the more cubic yards per acre. So the cubic yards per acre is the number that you're looking for as you design cells and landfills and that sort of thing. So that's really why that's the way it is.
Do I have any other questions? I really appreciate Santec and what all y'all have done at the landfill. It's really been good. It's been a big cost savings to the taxpayer. We appreciate everything that you've done. And, when you go to school, you don't think you're going to use geometry, but evidently we do.
we use a lot of geometry.
So there's a lot of math that's involved in all this. So, and we appreciate y'all's work and your expertise, because that's, the county wasn't, we were in the landfill business, but we didn't have a lot of expertise, and you guys have came in and really done a great job for us, and we appreciate
that. We appreciate you guys letting us be here. We enjoy it. Thank you.
Thank you.
Okay, our next item of business is update from Health and Human Service Agency regarding the collaborative efforts and initiatives to address the opioid crisis. And we have our HHSA Public Health Director, Patrick Johnson, and our HHSA Public Health Director, Supervisor Lauren Wood, and Post-Overdose Outreach Specialist, Jesse Lee Dunlap. And that's under attachment 2. Welcome, Patrick.
Thank you very much for having us. So we're going to give you an update on our efforts, and this is a community management of the public health crisis of our time. So this is a complex disease requiring the assets of local, state, and federal governments. We're going to give an overview of the updates of Substance Use Prevention Alliance, Perinatal Substance Exposure Collaborative, HHSA grants, and the North Carolina Harm Reduction coalition updates. And we're going to start with the context, current data, and the county community health assessment. And then if you have any questions. The first thing I want to show you is the current data. And if you look at one thing, we follow the overdose deaths, and in 2018 there were 23 overdose deaths, and right now in 2019 there's already 14 deaths, and there are 17 pending deaths. So 2019 has already been a difficult year, and it looks like it's going to be a worse year than 2019. So this problem is still ongoing and is not getting any better. Our efforts need to be continuing. And if you look at the overdose data from the emergency department, there is a bit of good news. The acute alcohol intoxication is decreased. The opioid overdoses have decreased, and the heroin overdoses have decreased, but there has been a slight uptick in meth use. And now Lauren is going to give you some more context on our community health assessment.
Morning, thanks. So the community health assessment is really the foundation of our public health, community health improvement work in Haywood County. We just turned in the most recent one in March of 2019. They come in three-year cycles. And this collaborative process really helped us determine our health priorities for the next 3 years, along with 72 other community partners that helped analyze the data with us and determine the priorities. Substance use and mental health was determined to be one of the top priorities, along with perinatal and early child health and chronic disease prevention. The backbone of the community health improvement work is through coalitions, collaborative interagency groups representing a variety of organizations. So the Substance Use Prevention Alliance is our substance use and mental health group coalition in Haywood County, called SUPA for short. Our mission, as determined earlier this year, is promoting health and resilience by advocating for prevention, treatment, harm reduction, and recovery. And we have a pretty broad membership, including public health, law enforcement, medical, behavioral health, harm reduction, other community-based and educational partners. That continuum of care image on the left is from the Institute of Medicine. It's kind of the recommended who you need to have in the room for substance use work. And then the image on the right is the community-based coalitions for drug-free communities, which really expand that focus to include youth and schools and civic organizations and a whole lot of other folks. So really through a very collaborative, data-driven strategic planning process throughout 2019, we have come up with 3 sets of action plans for our coalition. The first being youth prevention, so that's youth substance use prevention, reducing barriers to treatment and recovery, and then overdose prevention and harm reduction. All 3 of those are tied to grant funding that have been received by the various partners relevant to those issues. One of our ongoing efforts is really going to be forming a steering committee for SUPA, composed of high-up leadership in Haywood County to help keep us in check and to provide some accountability, to really expand our membership to include, as we expand the focus on youth prevention, we need more youth membership, teachers, and other folks involved in the school system potentially. And then maintaining awareness and collaboration with other community groups, one of which is the Perinatal Substance Exposure Collaborative, which also meets at our agency monthly. It is a group of professionals, public health, social work, medical, behavioral health, focused who are working with pregnant women, infants, and families affected by substance use. So we're really sharing best practices, facilitating referrals, presenting on timely topics, and coming together. And as a result of this foundational work, we are in the running for a potential Project Cara satellite clinic in Haywood County. This is a clinic that is currently at MAHEC, and it's a best practices clinic for pregnant women with substance use disorder. Because of the work we've done, building partnerships and bringing these folks who are working with these women and families together, there may be potential to embed a Project Cara clinic in a medical practice in Haywood County. So that's a really big one. And then lastly, I just want to share about the recent grant funding. You're probably aware of most of these, but just in the last year and a half or so. We have other grants on other issues, but these are the ones relevant to opioids. So a Lock Your Meds grant provided in-kind supplies, that is lockboxes for medication to be distributed to anyone who needs it. And then marketing materials. This time last year, I came and presented to you about the emergency overdose grant, which hired Jesse Lee and was from Department of Health and Human Services. Patrick presented to you last month on the Haywood Healthcare Foundation grant to initiate medication-assisted treatment at Health and Human Services. And the last one, the biggest one, is one we just got also through North Carolina Department of Health and Human Services. We'll be presenting that to you shortly, hopefully. But that will build on the work that Jesse Lee has been able to do and even expand it by hiring another full-time person to do linkage to care for the most vulnerable population, those involved in the justice system with a substance use disorder, as well as maintain the post-overdose outreach and syringe exchange work that is already going on. So I'm going to turn it over to Jesse Lee. Thank you.
Good morning, y'all. I want to emphasize what I've talked to Kevin about before, is that the North Carolina Harm Reduction Coalition's relationship with this health department is extraordinary. There's 100 counties in North Carolina, and about 2 of the counties work well in conjunction with harm reduction, and Haywood County is one of those 2. We also have an amazing relationship with the Haywood County Sheriff's Department. We stay in constant contact with those folks. We have a great relationship with the Waynesville Police Department, and we are about to start a LEAD program in Canton, right? So our county, especially in relation to our neighboring, like progressive Buncombe County, we're like way ahead of the game. And I know I throw a lot of daunting numbers at y'all when I get up here sometimes, but I want you to think of it like, so we have about 100 participants, and out of folks, and what I've heard from the Sheriff's Department is we probably address about or have a relationship with 75% of the folks who are in active use in the county. And so that means there's about 133 folks who are using drugs in illicit, we'll say, illegal drugs in Haywood County, or have a problem. So that's a really small number, because we're thinking like crazy big numbers, like the whole county, this or that. But 133 people is not, an insurmountable number of folks to help. We can definitely feed, house, and medicate that many people, and a lot of these people already have housing. So even if you look at it, maybe half these folks need that kind of help, that's an easy number to address. Because we have 100 people in the Haywood County Detention Center right now. About 100, Jeff. Where's Jeff? I saw Jeff. About 100 in there right now. Yeah. So that's at $90 a day per person. So, and we can address substance use disorder at a third of that cost. So just something to throw at you. It's a hopeful thing, in my opinion. Especially now we've got even more funding and more support from pretty much every angle. I do want to say about the overdose deaths, we might expect to see that increase because death by distribution went into effect yesterday, and all the states that have the strictest death by distribution laws actually have continued to see an increase in their amount of overdose deaths. And I want to point that out because I don't want y'all to see that, if that does happen, as a failing on the part of harm reduction. That is something that's really specific to those types of strict laws. So, and I'm ready for any questions.
I've got several. And this wasn't what you were talking about a minute ago. I've done the numbers on this data that we were given for 46, and I can't come up with 46 no matter how I put these numbers together. Can you get Patrick to explain where that comes from?
Let me go back to this.
Right there, yeah. See, if I take all of these numbers in each category, I don't know how you're coming up with the 46. I can't make it work.
Okay, it's the 14 is the suicides, plus the 34. It should be 48. It should be 48. It's the suicides plus the overdoses, so it's an error by us. It should be 48.
So if we go by that, each year, last year's was 52, and then the year before was 48 deaths?
Yes.
Okay.
Yes.
So you're basically just breaking down with the ones with alcohol, the ones with drugs, and the pending investigations.
I'm sorry, say again?
Are you taking the ones with alcohol, the ones with drugs, and the pending investigations? Where does that factor into that number 48?
Go ahead.
It doesn't add up because some deaths are suicides, but also related to substance use. I didn't see who asked that, I'm sorry. They may be a suicide involving substance use, so as not to double count it, the total is slightly less than the two added up. Does that make sense? And then 34 is the total, of which 21 and 14 are part of that. So the total substance use deaths is 34, the total number of suicides is 14. Just look at the bolded ones.
So 2 of the deaths that were suicides were also substance abuse deaths?
Yes.
So you've doubled them up?
Yes, some of the overdoses are suicides.
So if we take those now, we're at 50. If we take the 48 that are substance abuse, the 34 that are substance abuse, that's the ones that you're focusing on whenever you gauge your effort. The suicides, everybody wants to do something about suicide, but that's kind of an individual thing. Obviously, there's only 2 of them that are drug-related.
2 suicides are drug-related, yes.
So when it comes right down to it, 34 is the most accurate number of substance abuse deaths.
Well, yes, if you're including the alcohol, yes.
Yeah, so they're accidental. That's what I was looking at, was accidental. I understand the difference with suicide and accidental death, and I was trying to get to a number that shows the people who are using drugs that did not intend for this to happen.
Yes, but our focus is really on the 14 using the drugs. We separate them. When I send out when I break this down by the overdose deaths, we separate the alcohol-related deaths completely from the overdoses related to drugs. And I can give you that completely. We separate the overdose, we separate the alcohol-related deaths completely. I can send you that separately. That's a whole separate different category.
So what are we doing for the alcohol? It looks like if you just take these numbers here, it looks like the alcohol is the most prevalent.
Alcohol is a huge problem. Alcohol, we separate that. A lot of the alcohol-related deaths are a 70-year-old man who dies of cirrhosis. That's not what we're fighting here, and that's not what we're talking about here. But it's a huge problem. That's why we decided to count these deaths related to alcohol. And that's why when you look at the problems in the emergency department, it's the number one problem. But
that's kind of what brought that to my attention when I was looking through all this. What are we doing for the alcohol? It seems like we're focusing on the opioids and we're focusing on the drug use. What are we doing to try to help the people that are on the alcohol? Because it looks like we're missing a lot of deaths. Or is there, like Alcoholics Anonymous, is there somewhere that you're able to send them for counseling, or is somebody following up with them when they're admitted to the hospital?
Go ahead.
Back when I came to do that first the update on the opioid grant is what we had talked about with the plan with the emergency department. When we went and talked to the staff, we said, what is the biggest problem? They're like, alcohol. And so we decided to do follow-ups with alcohol whenever we get calls from the ED about that, for sure. But just like any other substance use disorder, you have a problem with treatment. There's like a lack of treatment, for sure. And our
Substance Use Prevention Alliance, our coalition action plans are not focused on opioids. We came here to provide an opioid update, but I wanted to share the context. But the youth prevention action plan, the reducing barriers to treatment and recovery, the overdose prevention and harm reduction, the first two are not exclusive to opioids. They cover multi-substances because we know that multi-substances are a problem.
You said there were 100 participants. How many have you been able to get into counseling out of those 100 participants? And I assume that's the people that are doing the needle exchange.
The interest is, every one of the participants has interest in treatment. But like I said, I've probably gotten about 10 into treatment. And, and that's a fight, Mark. I mean, it's hard. And not because they're not willing. What I'm saying is they are willing, but finding somewhere where they can go for a long time is really difficult.
Who ends up paying for if you're able to get these 10 in, who ends up paying for that? Are they able to qualify for Medicaid?
Yeah, mostly Medicaid.
Okay, so if they wanted treatment, they could get it for free, basically. Mm-hmm. All they would have to do is follow the steps.
But the wait lists and they've started shortening times at ADACT because there's such a demand for treatment. Like it used to be like a longer stay, and now it's like 2 weeks at the most that you can stay. And if somebody has had a lifetime of this, 2 weeks ain't enough to get them out of that,
Is Meridian able to do anything as far as counseling? I know we have the Balsam Center.
Definitely.
That helps out.
And even if you don't have a means of paying, they're not going to turn you away. They have a tremendously generous sliding scale, and you can go see somebody for like $8. And if you do express even a hardship with that, they're going to work with you. Meridian's been an awesome resource.
How many needles would you say? I know back in July it was an astronomical number.
Mm-hmm.
How many needles would you say you're giving out a month now?
It's around 12,000. And if you divide that by 133, so we've got about 107,000 syringes we've given out this year. And if you divide that by all the participants, by the number of days in a year, it works out to about 3 syringes a person per day, which is typical of someone who uses injection drugs, is to shoot up 3 times a day.
Okay. And whenever they come to get those, where do they go? I mean, do you come around to them, or do they have to come to DSS? Or
it's a combination of things. I go to people who are not able to come to like the health department, where they can meet me anywhere. So,
okay.
Does that answer your question?
Kind of.
All the supplies are based at the health department, so people can show up there.
So whenever you go meet with people to give them the exchange, they give you one and you give them one.
I give them whatever they express a need for, and then I take back what we always give them: sharps disposal containers, and then they give me back whatever they've got.
Okay, so we're not, if you give them 5 needles, when they see you the next time, they don't give you 5 back.
They usually give me more like 500 back.
We're trying to figure, and kind of where I'm going, I'm trying to figure out, all of a sudden, since we've started giving out needles, it's became pretty evident that needles are being discarded everywhere. A lot of people are being upset about it, and I'm kind of wanting to know if we're getting back all of the needles. Are we disposing of 12,000 needles a month, or do we have a way of tracking that, or do we need to create a way of tracking it?
We have about two or three Fridays ago, I had a meeting with John Feichter of Waynesville Town Alderman Board and some Meridian folks about how to address syringe litter, because with homeless folks, you're not going to have the ability to just like carry around all your used syringes for a week, because it's problematic, because there are protections for folks who use drugs as far as like carrying paraphernalia so they can properly dispose of it. But what we see is sometimes they get charged with paraphernalia, and the charge is eventually thrown out, but then they go through a rigmarole of being charged with the paraphernalia. So the easiest thing for someone who is homeless to do is toss a syringe on the ground.
So are the homeless people involved in the needle exchange, or do you ask whenever you are meeting, wherever you meet people at? I understand the part of them throwing them away and getting an additional charge for it. And like I say, that didn't show up until we were giving out needles.
Right.
So now, instead of, we're protecting the people from passing diseases amongst themselves, But now we're having needles laying everywhere that people are having to pick up that do not have a drug issue, and I don't think it's really fair. If we can tighten up how we do that.
Yes, and that is what we're in the middle of doing. Like I said, met with John and the Meridian folks, and John's already come up with a plan to address syringe litter in Waynesville, that it's going to be cost effective, like it's a cheap startup and it's a cheap maintenance. Because, that definitely needs to be addressed, and we are doing our best.
Well, I think you should go back to, if they don't give you a needle, they don't get a needle, because that's the only way it's going to make sure they do it. If they get stopped and they get charged with it, that's the byproduct of that choosing to do that.
But that's also not legal.
But it's not fair for the people that are having to clean the mess up. I understand that you're trying to address something with the town of Waynesville. Waynesville's not the only problem. They're showing up at State Employees Credit Union above your office.
Right.
So,
and I see that, as someone who does not use injection drugs, I believe it's my responsibility. This is a community illness that we all have to, it is a byproduct, and it's not fair, but life's not fair, and we have to help these people. And picking up syringe litter, and I can teach anybody how to do that safely, I'm available anytime.
Teaching people, I don't believe, is the whole thing. Having accountability to the people that are using the county services, the state services, those are the people who need to be accountable for what they're doing, not the people that are out here trying to clean up the mess.
And I would say that you and I, like someone who's not in active addiction and has serious substance use disorder, can follow that kind of logic, but people with substance use disorder, they're not able to follow the same logic that you and I can.
If they know that they have to turn in a needle to get a needle, I think the logic will kick in. That's pretty simple. A fourth grader can do that. I understand that these people that are addicted, they're focusing on one thing. But the whole key is to get the needles back out of the area, because until we started handing them out, we didn't have this problem. And I hear about it everywhere I go.
No, I hear
every
about
time
it.
I turn
well.
around. So I understand you're kind of your own entity. You do your own thing. But when it comes right down to it, we need to be accountable, and we need to make these people turn in a needle in order to get a needle if we're going to participate in this program.
And the one-to-one is a barrier, and I don't know if we have time, are we past time? I think that the syringe litter, that is definitely an issue, and that is definitely something that we could address.
I would appreciate it if there was a way to work that out. A couple of more questions.
Commissioner Pless, can I interrupt just to say?
Sure.
I think you may even be getting back as many needles as you're handing out. We don't know that from what I hear you saying.
A large percentage of what we give out.
To see if we can keep up with that and see what we are getting back. Are we getting back 75%, 50%? And that would at least track it. Maybe we can do that. So I think that's what Commissioner Pless is looking at or looking for. So sorry.
Yeah, if we're not the problem, then we want to know we're not the problem. But I find it hard to believe somebody's going to go to CVS, buy a bag of needles, and throw them away. Somebody who is truly homeless, like what you're talking about, I think they're going to probably hold on to them and take a chance on getting caught with them because they can't afford to buy those and this other.
I'd like to just point out Jesse Lee's efforts, and we are collecting as many of these used laundry jugs at the health department for Jesse Lee to give out to folks so that they can put their needles in these empty laundry jugs. Jesse Lee then collects them and takes them to the MRF for proper disposal.
And the Waynesville Police Department also takes our used syringes as well.
So I'd like to put that out. We'll take as many of these as possible at the health department from anybody.
And what are those?
I think your other colleague back there had something. Go ahead.
Yeah, you'll have to come up here. You'll have to come up here. And you need to say who you are and all that good stuff.
Hi, thank you so much for allowing me a few minutes to kind of chime in here. I know I'm not scheduled to speak. My name is Gary Ann Yoakum, and I am Jesse Lee's colleague. And I just want to say that there are several boxes around town and businesses, as well as all of the parks, the rec center, and I personally go and I empty those periodically. And then Detective Paige Shell at the Waynesville PD has made an arrangement for me to be able to provide her with those sharps, and then there's a disposal process that the PD goes through with that. Additionally, in the state of North Carolina, it is legal for people to dispose of their syringes in garbage cans. There are some stipulations for that. You're supposed to put it in something like that, put duct tape over it, label it. We know that people don't always have the means to do that, but in terms of us being able to guarantee that we will get back 100%, and if we're not getting those back, that they're automatically on the street, that's a fallacy. We cannot ever prove that those needles were not properly disposed of in a private way, unbeknownst to us, if that makes sense. Additionally, because of this syringe exchange, we are preventing the spread of communicable diseases. So if somebody finds an improperly disposed of needle, it is less likely that that needle will have any type of bacteria on it or anything that could cause the spread of communicable diseases, because we are ensuring that people are not having to share syringes. And I know that that does not, quell the fears in the minds of people whose children may come across one, but we are doing our very best to ensure that people have access to what they need so they do not have to share, and that these cost burdens for people who are uninsured, who may end up contracting something because they didn't have an extra needle that we've provided, it all comes back on us. So we're doing our best to look at this in not a myopic way of there's a needle on the ground, but in a really big, comprehensive way. And I hope that helps explain a little bit, but I assure you that we are doing our best, and we're trying to get some boxes, more boxes around town in bars and restaurants. And Cherokee, they have on one of their little areas, they have like multiple public syringe boxes that people are able to bring their syringes to. And so, we have some examples that are working in other communities, and I hope that we can come together and try to address this in a more comprehensive way. And when we get calls about them, we do go out. I carry the little tongs in the back of my car, and I have a box in the back of my car that I can put them in.
So folks can call if there's a problem. And
absolutely. Please
what's the number?
Share our number. Mine is 910. I don't know if anyone wants
to. Do they call the health department or?
They can call me. They can call Jesse Lee. I'm sure that the health department would be willing to field calls for us and just communicate that to us, and we'll go out and make sure.
If there's a problem with needles in a certain area, they just need to probably call the health department, and they can get a number where they can call and get those
absolutely
collected. And it does sound like y'all are you're addressing that issue. Like, I didn't realize there was all these places that you guys have.
Yes. I believe there are 21 boxes that I empty.
Really?
So,
okay.
Yeah.
And how often do you do that? Like once a week? Or?
I do it like every few months, and sometimes I go and there's nothing in them. So, and what we want to make sure people know about is that if they are homeless and they do have these structural issues that prevent them from carrying a bio bin or the laundry detergent bottle, because they will be targeted, no doubt about that, and they're carrying everything else in their lives on their backs. And so, and I'm not trying to make excuses for people, but we want to make sure that if we do have these things in public places, that the word is out and that people know where they're at and they're in, like a visible place. And that may not be attractive for a town that is based on tourism. And really, we want people to feel safe, and we want things to be aesthetically pleasing. And that may not be, but this is what's happening. And if we really do care about this, then we're going to take every measure together to make sure that we're addressing it.
And I do appreciate you. You all are on the cutting edge. Like I say, Buncombe County doesn't even have any of this, like J.C. Lee was saying. So we are being proactive, probably one of the most proactive counties in the state. I know I was talking with my son-in-law over the weekend. Homelessness is a problem nationwide.
It is.
And he's from the Franklin area, and he said there was 2 homeless camps in Franklin. So it's just not a problem here.
Right.
And then my mom and dad live up the river, up in the south end of the county, and there's homeless people up there, and they're not coming to town, doing this.
Right.
But there's homelessness is everywhere, and it's just a problem that it's just a multifaceted problem in the nation right now, and I appreciate y'all. The laundry detergents, I didn't know that, so if we can collect those and maybe just drop them off at the health department, you guys are distributing those to.
And Mr. Inslee, I so appreciate you saying all that and acknowledging that these problems are systemic, and it's not just this one thing that we can do to be able to address this. I mean, we're looking at decades of poverty and suffering and trauma, and there's just so many issues right now that factor into this. It's not just one thing where someone's making a choice to use a substance and toss a syringe. I mean, there's so many structural issues.
It's mental health. People don't want to be homeless. Nobody wants to sleep under a bridge. There's mental health illness there is why they're doing this. And unfortunately, the state and federal government are cutting mental health services and funding. And it seems like we had proper funding, and for some reason, it continues to diminish. And that's not really helping the situation at all. If anything, they need to be looking at programs to increase it, and to go with, like Jessie Lee was talking about, solution-based programs that she studied, abroad and stuff that are working.
Yes.
And we need to try to, look at doing some of those. I
Absolutely.
think that's the only way we can combat that, I think.
Absolutely. Thank you all so much for your time. Sorry for co-opting.
It's okay.
We still need to come up with some way of accounting for it. I can understand the passion for these people, but she said she carries a pair of tongs around to pick up the needles with. These kids walking from Waynesville Middle School, 12, 13, 14 years old, don't have a set of tongs. But if they stumble across some of this, now you've gone from 133 people in this county to how many go to school there? Several hundred that are potentially exposed. I see them walk into the library quite frequently. I'm assuming that's where they go after school. We need something that's going to start controlling the amount of these needles that are showing up, because the only common denominator right now is us, because I think we're giving them out. So whatever you can do to make it work, I would love to not see any more and not have anybody call me and say that they're littered all over Frog Level and that side of town. Are you dropping off any in Canton?
Yes.
Okay.
All over Haywood County.
Okay.
Can I give you my number and you can call me when you get these calls, and I will go right out, do whatever I can, because I don't want to have problems.
They don't call. The people in Frog Level, if you'll go down and talk to them, the people that own the businesses and stuff down there, they're the ones that are seeing it on a regular basis. Sulphur Springs Road, Smathers Street, all of that is where everything is starting to show up. And I assume that's because the people that were staying there. But a lot of the people in there, they don't want you to come pick the needles up. They want you to stop letting them be out there. That's kind of what it's going to boil down to.
But we will provide a handout about where to call if someone finds needles.
I did have a question. What are when you're talking about some of the deaths, are you seeing, is it pretty much a broad spectrum of deaths age-wise, or is it younger, or is it just pretty well like all ages?
It's all ages.
Really?
It's surprising. Actually, 40s, 50-year-olds overdose deaths, yes. It's actually not younger people. It's older people.
Okay.
Yeah, and the average age is around 51, in the early 50s.
Right. And then I think Jessie Lee was saying that some of your the people she works with have homes. They're not just homeless. Isn't that right, Jessie Lee? So it's people that have homes that are that you're working with to try to help with this, not so much the homeless population and everything. Hey, go ahead.
Oh, I'm sorry. You through?
Go ahead. Yeah.
Last year when we approved this grant, I was kind of interested in seeing some tangible results as far as a reduction in deaths. And that's our goal. That was our goal when we initiated this program a year ago, but I understand that the numbers just aren't stacking up. And that could be a result of an influx of more drugs, different kind of drugs. I see where you see on your chart meth maybe is on a little bit of an increase, which these things we can't control. But kind of going down that line, I know if we can prevent the second overdose, that's kind of the goal. Keeping these folks from having a repeat trip to the emergency room and doing all that. But I know the cost is tremendous, across the board for that. But did I understand in your presentation that they've kind of changed the rules about the reporting death by distribution, I think was. So it's not that we don't really have a good gauge a year down the road because they've kind of changed the way the deaths are reported. Did I hear that, or?
No, death by distribution is a law not related to that.
Okay, I thought maybe I heard they had maybe changed the reporting method about.
Go ahead.
That's right.
But
to address the prevention, like, you want to see a decrease in the overdose deaths. We have, with getting naloxone into the community, prevented 207 deaths this year.
Great.
So that, just as another number.
It's good.
But the graph does show it's going down.
Yeah. Yeah.
Yeah, everything, except for meth, it's making a comeback, looks like, yeah. But it looks like 2017 was a spike.
Correct, yes,
graph.
it was.
So it looks like some of our efforts are starting to take effect.
It does, except for the meth, yes.
Yeah.
Which is a concern.
Yeah, right. And
Yeah.
And really it's, if we're getting a downward trend, and that's what we want to see, is a downward trend, so. Does anybody else have any questions? Anything else you all want to add? Or?
No, sir.
Okay, I appreciate you bringing the jug. I didn't know that. So, so anybody has detergent jugs that's watching this, maybe wash them out and take them by, just drop them off at the health department.
Absolutely.
Okay, that'll be helpful. Okay. All right, well, thank y'all.
you.
Okay. Okay, our next item of business is their update on Johnson Creek property. Our program administrator, David Francis, will present that at this time. Welcome, David.
Good morning, Commissioners.
Good morning.
Hope everybody had a good Thanksgiving. I know you hear a lot of sadness with this, but we still all have a lot to be thankful for as well, too. I wanted to bring you up to date on the Johnson Creek property. As you know, that back in 2017, we started with an idea to bring some soil into this property. This soil is in the flood plain. There's 6 acres that are in the floodway that we won't be able to do anything with. Can't have an improved structure there, but we can put parking and things like that. 2017, we had an agreement with the developer of the Publix. Unfortunately, that didn't go as well as planned. They had some sloppy soils there, and as you can see, that soil is still sitting on Howmill Road as we speak. But since that time, we went into negotiations with the neighbor at Johnson Creek, Dennis Hall. We're able to borrow soil from his property to move over to the Johnson Creek site. And so what we're trying to do is to raise it out of the flood plain, the base flood elevation. So we raised basically 16 acres, approximately 3 feet across those 16 acres. So luckily to report, things are going very, very well. This is the way the site looked in July of 2018, when that we were approximately doing about 8.5 acres then with the 25,000 cubic yards of soil. This is the site in October. We signed an agreement back in September to start the project then. And since that time, we have moved 33,000 cubic yards of soil has been placed on the site. We have reached elevation to where we can apply to have those 16 acres removed out of the floodplain. Next would be seeding and site restoration to both the borrow and the field site. And the good thing about the project is that it is under budget. So we have a few things to button up. We got a couple things at both sites, but more or less we're done. Next things that we're going to be working on is getting it show ready. Need some work out there, install water and sewer at the site, work on better entrances to the property, and review possible subdivision plan, which we subdivide the property up for an industrial park, and prepare covenants for such as we do that. So, questions?
Questions? This has turned out well. So you've done a good job with it. Appreciate it.
We called a good break with the weather.
Yeah, we did.
Helped tremendously.
Yeah.
Dry for a long time.
Yeah, that dry weather always helps when you're moving red clay dirt.
Mm-hmm. Yeah.
I like the under budget part, David. Keep that up.
We worked hard with the contractor He's done a good job for us, that's for sure.
And you're working with McGill to do the entrances? Those have to be approved by the state and all that? So.
Yeah, the driveway permit, it was temporary, so we'll have to get those expanded.
Right. And then water and sewer connection would be important to have that.
Correct.
Let's see, sewer's on that side of the road and
water's on the other side.
On the other side,
Correct.
so you have to bore that?
Yeah.
Okay. Well, that'll be good for that side of the road too, up and down.
Because one of the things that, with inheriting the Beaver Dam site, the infrastructure just stopped at a point. So I want to make sure that it's all there and ready to go for somebody who wants to move in. Okay.
Anybody have any questions? I think you answered them all, Dave. Thank you. Okay, our next order of business is the discussion adjustment to the agenda. Does anybody have any at this time? Okay, moving on, we'll go to our consent agenda. The first item on the consent agenda is the request approval of the November 18th, 2019 regular meeting minutes. Does anybody have any changes to those? Okay, and the next item of business of the consent agenda is to request approval of the 2020 holiday and meeting schedule. And this is under attachment 3. Does anybody have any comments about those? Or changes, or does that look okay to everybody? Just note that Martin Luther King Day and Labor Day will be on the Tuesday after the third Monday and the first Monday. Okay. Hearing no questions, I'll entertain a motion we can approve the consent agenda.
So moved.
Is there a second? Second. Okay. Any other discussion? All those in favor indicate by saying aye. Aye. Anyone opposed? Okay. Our next order of business, our regular agenda, our first item of business is to request approval of proclamation recognizing December 2nd, 2019 as Dr. Barbara Parker Day, honoring her dedicated 38 years of service in public education in Western North Carolina. We have our program administrator, David Francis. David.
Thank you, Commissioners. Dr. Parker. As I grew up knowing her as Barbara Sue. Yeah. So, I first met Dr. Parker when I got out of college and I started working at Waynesville Middle School, then Waynesville Junior High School. And she was in the Gifted Exceptional Children program and was a mentor to me then. And there's not many people who you meet along the way who you know that their life is spent where their life is supposed to be spent. And Dr. Parker is one of those people who's dedicated her life to education, and you knew that's where she was supposed to be. But she has honored us throughout her career with being a middle school principal, superintendent down in Rutherford County, and came back in 2013 to become our president of Haywood Community College. And over the last 2 years, when I got back and was working with the economic development, it has been a real pleasure to work with Dr. Parker there. And we were just hitting our stride here over the last year. And we had made a lot of inroads and had built some new friendships along the way. And it was a pleasure, and it was an honor to be able to take some of the visiting businesses that we had here to Haywood Community College. And just a couple of months ago, we had a CEO of 14 different companies and the president of this company that was moving here. And we spent a half a day at Haywood Community College, had lunch up there, and they walked away and they said, of all of the places that our businesses are throughout the United States and the world, this is the best community college we've ever seen. And if we get this business here, it'll be because of Dr. Parker's efforts in Haywood Community College and what they have, the backbone of economic development here for Haywood County. So it's been a real pleasure to work with you.
As well.
Okay. So I'd like to read the proclamation. Okay. That's it. Whereas Dr. Parker has dedicated her life to education as a teacher, principal, assistant superintendent, and the president of Haywood Community College. And whereas Dr. Parker has provided exemplary leadership, devotion, and commitment to economic development and workforce training with construction of the Public Services Training Facility and the nursing building at Haywood Community College. And whereas Dr. Parker's 38 years as an educator has earned her the respect, admiration of colleagues, peers, and students. Her impact on the lives she has touched is everlasting, and her contribution to Haywood County will resonate for generations. Now, therefore, be it resolved that the Board of County Commissioners of Haywood County, North Carolina, does hereby call upon all citizens to recognize December 2nd, 2019 as Dr. Parker Day in Haywood County, adopted the second day of December 2019.
Thank you.
Thank you.
Thank you.
My goodness, I didn't look at the agenda before I came in the door. I should have. Mr. Francis said we want to say thank you. I didn't realize we were saying thank you in such just an amazing way. You know, as I was listening to all the reports this morning, as I watched you all work, I realized, and I knew this, but I realize again, how fortunate we are to be where we are in Haywood County. The collaboration of all of our agencies, of our counties, of our towns, all for the good of us, the citizens of Haywood County. I am very honored and humbled to be remembered in such a way. It's truly been a privilege to be an educator, to do what I have done, and I could not have done it without all the people who have surrounded me. I really appreciate your comments about the college, but that has to do with everybody at that college. We have wonderful people there. We have a wonderful school system in Haywood County, and I'm just very, very privileged and honored to have been a part. And I thank you so much for your support of the community college. All of you have been there. All of you have had a tour, and I drug you around, and I appreciate you coming and seeing the college, where we are, where we want to go in the future. And I'm very excited about Dr. White. I know she's going to do a wonderful job. I want to thank Mr. Moorhead, Ms. Davis, Mr. Francis, all of you all for your support. I appreciate it very much and look forward to watching our county continue to grow and do wonderful things. Thank you so much.
Anybody have any comments?
Well, I just want to say I really appreciate what you've done at the community college. I will say this, and I'll date you a little bit. I think that I guess I was 13. If you were working at the middle school, and the other day, Danny Davis said something about me being 13 years old, and I believe that's when you came to Waynesville Middle School. And so I've known you since then as a teacher, as a mentor, and I'll just tell you, it has been absolutely great what you have done at the community college, and how you've made it so easy for the county to work with the community college over the last several years. And I had been the chairman a couple times and dealt with the community college, and we as a board have dealt with the community college over the years, and it has been somewhat difficult. But with you there, it's been such a pleasure, and you've made such progress. And I'm aware of what David said about the company that's coming here, or hopefully that's coming here, and the role that you had in that. And it's certainly appreciated. And I hope that people can remember you by that.
Well, thank you. I appreciate that. It works two ways. We've had great communication and a very good relationship, and I'm very grateful.
You know, I've served a long time on the board too, and the community college. It's been a pleasure to deal with Dr. Parker, and your new replacement's going to have big shoes to fill, and I'm sure y'all are confident that she will. But we definitely going to miss you. You know, and I knew your father and your grandfather, and I know they would be. I think your grandfather was the first superintendent of Haywood County Schools, and I know they would be very proud if they knew the work that you had done this morning and everything. So. It's just been amazing. You know, we appreciate all that you've done for the community college, and really to have businesses come in here like David was talking about. That's just another reason for them to come here, if you will. I mean, these businesses are looking for places to go, and you've worked with so many businesses with Evergreen. I mean, the college has over the years, and now with the nursing program. We really need to step up in the medical field, and y'all are doing that, and you've taken that on. I really appreciate it. Does anybody else have anything?
Certainly. I'd like to echo Kirk and Kevin's accolades to you, and a little personal reflection. My daughter actually enjoyed being at HCC, and she got elected to be the president of the student council out there, student government. And she came home and she kept talking about Dr. Parker this and Dr. Parker that. And I thought, well, who is this Dr. Parker, you know? And I didn't know, but I've known your dad. I knew your dad from, over the stockyard in Asheville and Charles, and he was just a great guy. And
thank you.
Then after meeting you on the tour, and Kelsey just had great words to say about her experience there at HCC, and she was glad to make all the meetings and
she
on
was
time.
a fine young lady. Is a fine young lady. We're so proud of her.
Yes, we are. And but I echo the sentiments, and I know from my tour. You get it. You're a great salesperson, by the way, and the face of HCC, and that is a unique gift from God that people have. And you put Haywood County and HCC at the forefront, and you actually were a beacon of light on that facility. So I do echo fellow commissioners' accolades to you and say thank you and
thank you.
Congratulations.
Thank you very much. Thank you so much. Thank you to all of you.
Just a quick comment as well. I just want to echo what all of them have said about you. I got to know Dr. Parker when I was first elected, and you had an impression on me from the get-go, and I appreciate that. And I know you do, all the students as well, and anybody you come in contact with. So thank you for all that you did. It's nice. See, it's almost like the mountains here, when we leave out of here and you're coming back home and you can see the mountains, you're appreciative of where we live. And I think the college is like that a lot. We forget what a jewel we have sitting here in our community, and it is the college. I actually attended the college myself. My middle child is going there now. So it's a beautiful college. You've done a great job up there, and we just want to thank you. And like the other commissioner said, I could say the same things they have said, but thank you is good enough.
Thank you. It's been my privilege.
I do want to mention briefly that behind every good woman is a good man. Greg Parker's back there, and Greg, you and he met at the middle school.
We did.
Yeah, because the kids, we used to talk about it, that he was sweet on you. But I have interacted with both of them in other places, and I will say there's truly a real support back there.
Absolutely. I couldn't have done it without him.
And
oh my goodness.
And I knew him when he was kind of tough too.
I remember those days.
But I know he has been. I can just tell by being around both of you that there's a tremendous support, and y'all have a great marriage. And
we do. Thank you very much. Thank you so much.
Yeah, and Greg, you can. It seems like every time my wife and I go out to eat, we run into Barbara Sue and Greg at a restaurant. So I hope y'all have a great time in your retirement and whatever y'all do in the future. I know you want to get away from working and start doing some really good things, and I wish y'all well in all that y'all do.
We look forward to it. Greg may send me back.
If you didn't hear that, she said that Greg may send her back. So thank you. Thank you. Okay, our next item of business is approval of a resolution of the Haywood County authorizing the purchase of 7 2020 Dodge Durango Pursuits, all-wheel drive, 3.6 liter from the Performance Chrysler Dodge Jeep Ram, and 1 2020 Ford Escape S 4x4 from Capital Ford, and 1 2020 Chevrolet SIL Silverado 1500 Crew Cab 4-wheel drive from Modern Chevrolet in Winston-Salem in the amount of $241,822.71 to be paid from budgeted funds for this fiscal year. We have our chief deputy here, and we had approved some vehicles that we weren't able to buy. So now this is our backup, so we're not buying more vehicles. The vehicles we approved for you to buy, I guess a few meetings ago, we can't buy and I'll let you explain all that, Chief.
Good morning, Commissioners. Yes, that's exactly right. We received after all the foundational work had been done, to go ahead and follow through with the resolution to purchase the original vehicles that we had spoken about and brought before the Commissioners. That was approved on the 22nd of November. We received an email from one of the 3 dealerships under the North Carolina Sheriff's Association procurement plan from Chrysler. Mr. Moorhead, I think, received that as well too. and Mr. Boyd, in regards to the 2020 Dodge Charger, the Chargers, the all-wheel drives. Evidently, Chrysler has found some sort of defect, from what we understand, in the transmission, and they have canceled 4,000 orders nationwide. Of those were our orders as well too. So obviously, with that email, it sort of put us into a scramble mode. We went back to the North Carolina Sheriff's procurement plan to look at what our offers were. There are Dodge Chargers still in play, but they're the V8 rear-wheel drive, which doesn't do well for us in the mountains. So we always purchase all-wheel drives, which is more practical for us. Unfortunately, that's the ones that they have discontinued or stopped the order on. The only other options that we had were to look at what was available and to move forward with it. And under the procurement program, the Dodge Durango is actually the one that's going to fit that bill for an all-wheel drive as well too. And we referred back to the same costs that were projected out and received under the procurement program that were presented statewide under the state contract effective back July 1. So with that would have us purchasing, in place of the 10 Dodge Chargers we had originally talked about, would be 7 Dodge Durango Pursuit all-wheel drive 3.6 liters, and it goes back to performance. Chrysler, Dodge, Jeep, Ram out of Clinton, North Carolina came in with the lowest bid under state contract at $27,574 per vehicle, and 1 Ford Escape 4-wheel drive, which came in at the lowest bid through the procurement program through Capital Ford in Raleigh at $23,335.71, and 1 Chevrolet Silverado, which came in through Modern Chevrolet of Winston-Salem under the state contract procurement bid of $25,469. So it reduced the number a little bit, but the cost was just a little bit more, but not much. But we needed the all-wheel drive in order to be able to be practical throughout the year due to not only the snow and so forth, but the all-weather tires and so forth with mud and hills and the terrain that we deal with. So.
If you live in the mountains, you need when you live in Haywood County, you really need to have a 4-wheel drive because.
Yes, sir. I think it's somewhere the highest geographically the highest county east of the Mississippi. So obviously that stands to reason. But with that, we are asking for this resolution to be passed to be able to purchase those with previously funded monies out of this fiscal year budget in the total sum of $241,822.71.
Anyone have any questions for Chief? No? Okay. I'll entertain a motion. We approve the resolution.
So moved.
Second. Any other discussion? All those in favor indicate by saying aye. Aye. Okay. Anyone opposed? Okay. Thank you, Chief, and maybe we can get those. keep you guys rolling.
Thank you very much.
Okay, our next order of business is appointments, and we have our county manager here this morning.
Excuse me. Did you want to go back and pick up the one that we didn't do the
we need a
motion for the
Oh,
I wondered about that. If we need to.
Yeah, I'm sorry. That's.
I'll move to approve the proclamation recognizing December 2nd, 2019 as Dr. Barbara Parker Day.
I'll second.
Okay. All those in favor indicate by saying aye. Aye. Okay. Thank y'all. Thank y'all for catching that. Okay. Okay. Now the appointments. Go ahead, Bryant. We have a request approval appointment of Jimmy Flynn, Chris May, and Hannah Muter, I guess, to an appointment of Ed Underwood to the Canton Planning Zoning Board's ETJ. Attachment 5.
Thank you, Mr. Chairman. We reached out to Canton to see if those appointments had been, reappointments and appointments had been made by their board, and they let us know that they did. So it's just a reappointment of Mr. Flynn, May, and Hani Murder. And an appointment of Ed Underwood to the Canton Planning/Zoning/ETJ Board.
Okay. Can we have a motion for that?
So moved.
Okay.
Second.
Any discussion? All those in favor say aye. Aye. Okay. Anyone opposed? Okay, Brian, go ahead and do the second one.
In the spirit of last names that's hard to pronounce, we got confirmation from Maggie Valley Board of Aldermen that they approve the nomination of Mr. Hoogerwerf to the Maggie Valley Zoning Board of Adjustment / ETJ Board.
I'll entertain a motion for for that approval.
Who are we approving?
Item number 2, Joshua Hoogerwerf, I believe.
I move to approve the first Hoogerwerf that I've ever known to the Maggie Valley Zoning Board of Adjustment.
Second.
All those in favor say aye.
Aye.
Okay. Thanks, Kurt. Okay. Our next order of business is closed session, and it'll be acquisition of real property, 143-318.11A5. I'll entertain a motion. We move into closed session.
So moved.
Second.
Okay. All those in favor say aye. 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 Okay. Okay. We'll be in closed session. We enter the chambers in the back. Okay. We're back from closed session. Does anyone have anything further for the board? Hearing none, I'll entertain a motion that we adjourn.
So moved.
Second.
Okay, all in favor, say aye. Aye. We're adjourned. Thank you.